Well, everyone, I'm really thrilled to be able to bring you this bonus interview with Dr. Rachel Brown, who is a psychiatrist, a metabolic psychiatrist, and we're going to learn exactly what that is in this chat with Rachel. Thank you so much for being a part of the summit, Rachel.
Oh, thank you for having me. I'm delighted to be here and to be able to speak.
Yes, I am very excited, as I said to you just as we chatted before we recorded, and I know that the participants are really going to enjoy what you've got to say all about your work and of course your book that you've just released, which is really exciting. But are you happy to start by just sharing with everybody who you are, what you do, and yeah, what brought you into the low carb space?
Okay, gosh, big questions. Yeah,
yes.
Absolutely. Lots to talk about. So my name's Rachel Brown. I'm a consultant psychiatrist based in the UK. So I've been working in psychiatry since 2004. So I went to the University of Edinburgh, graduated 2003, and then went straight into psychiatry because I just knew that was always what I wanted to do. So that's why I went into medicine in the first place. I've been a consultant since 2011, and I currently work in a crisis team. So I don't know what things are like in Australia, but in the UK we have quite a number of different crisis teams. Our team is called an intensive home treatment team, but they have varying names depending on where you are in the country. So I tend to see people when they're in acute crisis. So often people acutely suicidal or psychotic or severely depressed, all sorts of different reasons that people come to the service that I work in. So from a low carb point of view, what brought me into that? Goodness. I think I first ventured into low carb probably around about the year 2000 when Atkins was all the craze, and Atkins came out.
Yeah.
So a long time ago. And that was just for personal kind of health reasons, really, that I grew an interest into that. I wouldn't say I've been low carb that whole time, so I've strayed away, and I've just always had an interest in nutrition and general health, not just mental health. So I've done lots of kind of personal experiments, I suppose you could say, over the years with different diets. I can't say that I've done them all, but I've tried quite a few.
Haven't we all though?
Oh, I know, absolutely. So yeah, lots of trial and error, and it's a learning curve for everybody. I think the worst I probably did was being vegan for about 18 months. Yeah, so that was about, gosh, when was that? I think that was around about 2010. And definitely my health suffered at that time. Although you don't always really recognize that when you're in the midst of it. So yeah, the retrospective lens is very useful to be able to draw conclusions about health. And so, for example, when I was vegan, that's the only time I've ever had flu in my life, and there were various body composition changes that weren't healthy. So I remember thinking I was losing muscle definition and getting just a bit softer overall, and never really satiated. That was my experience.
And that makes sense, doesn't it, when you understand nutrients in food and what you're not getting when you don't eat animal protein or any animal foods. Did you notice a difference mentally as well, or just physically for you?
I think it was more physically for me. So I don't, it's quite a long time ago now, so I don't really remember having a particular difficulty mentally, although I'm aware of lots of others who have, certainly in the low carb, keto, carnivore space. There are people who definitely their mental health suffered, and brain fog and so on and so forth. So I've got a 9-year-old son, and I was low carb before I had him, and then during pregnancy that just all went to pot. As it can do for a lot of people. But as soon as I had him, I went straight back to low carb. I would say generally over the years, I've been low carb as opposed to very low carb. So Mark Sisson, is, I'm a huge fan of Mark Sisson and his work, and it was really Mark's Daily Apple that I got very invested in reading, and his newsletters over the years. And I really enjoyed his books and his ancestral approach to health. And epigenetics that he speaks about in relation to food and the impact it can have at a cellular kind of on a genetic level in the body. So that really interested me, and I followed him for many years. And then probably I've been carnivore for 3 years now, and I would say I went more keto around about 5 years ago. So that's been the timeline for me.
So was there something that kind of happened that kind of took you from low carb to keto to carnivore, or was it just more interest in trying to see how you felt, eating slightly differently? Or
it was a bit of both. So I suppose I felt like, I wanted to lose a few pounds or a few kilos, that sense. I know for a lot of women, many people struggle with their body image, and particularly I think teenage girls and young girls. So I think initially keto piqued my interest just from a losing weight point of view, although I didn't really have very much to lose anyway, but also about health, for health reasons. So I have, a history of cardiac disease, cardiovascular disease in my family, and also some neurodegenerative disorders. So I was really thinking ahead about my health kind of longer term. And that's what got me into keto, really. And then all the reading and the research around the benefits of ketones and for inflammation. You'll know the drill with all of that. And then I think carnivore I got into really just out of curiosity more than anything else. So someone I really enjoy their work and follow them is Vanessa Spina, the ketogenic girl. So I really enjoyed her book, and I purchased one of her meal plans and was in her Facebook group for a while. And I think I was introduced to carnivore via a post that she'd put online, and I thought, what is this? So
is she
like a lot of
carnivore
people
now, or has she?
I think she's more keto. So I think she has spells where she's carnivore, and then other times when she introduces other foods again. So yeah, what was I thinking there? So so I saw her post and I thought, what on earth is this? It sounds absolutely crazy. There are people out there who don't eat any fruit or vegetables.
That's what I thought.
I just insane. I remember saying to some people in my office, and like people who aren't really that interested in diet, but I just couldn't help it. We were in the office, and I said, do you realize there's people out there who don't eat any fruits or vegetables? Is that not just insanity? And then they were nodding along, agreeing, yeah, what's that about? But then I started to do my research into it, and I listened to Michaela Peterson's talk. I forget what conference that was at, but she obviously went through her whole health journey of multiple different health issues that she's had since, from childhood, really, including mental health issues. And it was just such a compelling story. I thought, there's got to be something to this. And then I ended up, I think it was Sean Baker, a talk that he did at one of the meetings that was online, and it was just a very compelling discussion around the lack of really robust data that we have in relation to nutrition.
Yeah, amazing, isn't it?
Yeah, absolutely. And I just went from there. And I suppose, in my book, I talk a bit about whether people are abstainers or moderators, and I'm very much an abstainer. So like I do a lot of things, I just, once I looked into carnivore and I thought I need to give this a go, I just went straight into it and haven't looked back, really. So
yeah. Wow, 3 years. So I've been carnivore-ish, like I did 6 months when I was diagnosed with Hashimoto. So that was 2 years ago for me, and that completely fixed things. And now I'm kind of probably like Vanessa a little bit. I kind of do, not that I plan cycling. It's just that, I've got a family, and sometimes we have, we might go and have some Greek food, and I'll have a Greek salad, or, like there's different bits and pieces that will come into it now, but I would say predominantly 90% meat-based, and just feel fantastic. And it is like that though, when you describe it to someone. I did a post, it's interesting when I post meat, because I wonder what comes back, but I did a post the other day just on my meal prep of lamb chops, and it was just, it's so easy, right? Yeah, it's just like salt, cook, eat. And I just remember when I first came across it, I think my husband heard Sean Baker on Joe Rogan. And because he's very interested in health, and we both love Mark Sisson as well, like followed him for years. I mean, if we're as good and fit as he is at his age, we'll be doing something right.
Absolutely, yeah.
He's amazing. But my husband heard Sean, and he's just like, get a load of this, you've got to have a listen to this, blah, blah, blah. And I just remember going, my instant reaction, as we all do when we come across new data that doesn't align with what we believe, I was just like, that's just crap. How is that possible? That can't be possible, blah, blah, blah. And anyway, of course, when we get a little curious and let that sit, and then I had clients coming to me going, oh, have you heard about carnivore? You know, and I'm like, yeah, don't know. I really got to look into it a bit more. And of course, when you do and you try it, and it's like, And then, you know, I think it might have been Ken Berry that was like, just give it a go. Do it for a month, do it 2 months, 3 months, see how you go. You know, you can't do anything, you know, any damage to yourself when you do that. And yeah, it is phenomenal. So I'd love to know, you know, what fascinates me with people in the low carb space is most people are here, certainly from a medical perspective, because of a personal experience. So then how does that layer into your work? I mean, I know you have the book that we're going to get to, but do you get to talk about nutrition in your work? Because I wonder, in crisis, whether that's just, does that happen or?
It is difficult. So I did training with Georgia Eade. It may have been 2 years ago now. So her ketogenic diet for clinicians training. And I remember speaking with her about it. And out of all the people in our group, she did say that I was possibly in the trickiest position in terms of where I sit within the service, because people in acute crisis, it's not the ideal time to talk about having what can be quite a drastic change in people's diets. And unfortunately, I would say the vast majority, if not every patient that I tend to come across at work, they're existing on processed junk food diets, essentially, or for those who aren't, some of them have whole food diets but tend to be vegetarian or even vegan. So I see a lot of that as well. And all of those would be far from ideal in my eyes in terms of my views on nutrition as it relates to mental health, never mind the rest of the body. So I try to sow the seed with people. So when people, we tend to work with people over several weeks, for example, and we have in terms of the patients that we see, there is a variety, or there's a variation in terms of how acutely unwell people are and where they are exactly in their journey of having had an acute episode of mental disorder. And so there are times when I've been able to sow a seed and just have an introductory conversation with people and leave some information that I have from Georgia Eade and some other worksheets, kind of information sheets that I've made up. So I do that, but I'm not in a position in my NHS work to work with somebody one-to-one in terms of really making a big dietary change and then following them up over a longer term basis. That's just not where I am, and I'm very torn about that because metabolic health is my main interest, but I also enjoy the acute side of the psychiatric work that I'm doing and the team that I work with. So it's early days yet, I think, but I know of one or two people who, once things have settled down for them after an acute episode, who have ended up going keto. So that's really nice to hear.
Yeah, well, you know, they say, you know, you never underestimate the power of planting a seed. I mean, seeds are so important because, you know, we don't change from the first time we hear something, do we? And, you know, it's so important to have that crisis care. That work you do is you know, is just so important. But those opportunities just to open a little crack, you know, and then there is, you know, obviously your book and the work that you do on social media, and then others. I mean, if people find you and they're curious enough, or find somebody else, it you know, it might resonate. So I think it's wonderful what you're doing.
Thank you. Yeah, it's I need to think about my future career path, I think, because it's probably 2 or 3 years ago now, the acute service, there's a service where people can phone up same day and be seen in an emergency situation. And I remember the nursing staff who work in that service saying to me, there's somebody who is repeatedly phoning here asking to speak to you, and then talking about diet and saying they need to speak with you. And I felt very guilty that this person wasn't going to be able to have access to somebody to actually speak with about this. But it's obviously someone who has done their own research and had found me via the Diet Doctor website, because I remember thinking, how do they know about me and that I work here? So there are people out there who are doing their own research and thinking beyond what the so-called experts are saying. So I'm a big believer in everybody having an open mind and just trying to do their own research and reading, you know, in whatever capacity they can, and look for other opinions. And
that's right. And I am too. You know, even when I do a post about meat, it's like, you know, don't believe what I'm saying. You know, this is, you know, you really do have to think for yourself, and you do have to read and listen and see what resonates with you. And, you know, I try and just peel back all the layers of dogma and beliefs and just let's just look at the facts. So if we talk about nutrition, it's you know, I mean, I don't think it's dissimilar here in terms of how it works in the medical system, and certainly, you know, psychiatry. I only know Georgia and you. I mean, there really is, there's a couple of others I know, but not many, you know, who would even remotely mention nutrition. I mean, a lot of doctors still wouldn't hear, even in terms of metabolic health for our body, so let alone our brain. So maybe could you explain a little bit about, you know, we're going to bring into your book. So your book's called Metabolic Madness, Understanding Why Metabolic Health is the Key to Mental Health. So I know that's a whole book in that topic, but what is it about metabolic health and mental health? Is there a way you can kind of sum it up, you know, shortish, and then people can buy your book?
So it's not just with mental health, but I think all chronic health conditions have inflammation that underlies, you know, as the underlying cause. And that's widely accepted even within general psychiatry, that inflammation is involved in all mental disorders to an extent.
So it's not a chemical imbalance, it's definitely, it's inflammation, and that's kind of agreed?
So there's research evidence showing that inflammation is involved in all mental disorders, but inflammation can have knock-on effects in terms of chemicals and neurochemicals.
Right.
So when people eat, so a lot of people just don't realize that having a high sugar diet or a high carbohydrate diet doesn't in itself contribute to inflammation. It's also connected. So oxidative stress is another issue that I cover in the book. It's very hard to think of one system in the body in isolation from all other systems. So from my point of view, I've trained in functional medicine as well, which is of huge interest to me. And gut health is absolutely key as well. So we know that there are clear connections between the gut and the brain, and that's obvious to see. For example, if you're someone who gets nervous or anxiety before an event, for example, some people, it can be a common experience to have GI symptoms, so upset stomach, diarrhea, even for some people. And we know now from research that there are very clear connections between the gut and brain, but everything's really interconnected. So I can't say that it's not to do with a chemical imbalance, but what I can say is there's clear evidence that inflammation can end up tipping certain neurotransmitter systems out of balance and end up going more towards the excitatory neurochemicals and having less of the relaxation neurochemicals. So I try to, it's all very complicated. I try in the book to do a whistle-stop tour of the science and make it accessible to people, and try not to have too much medical jargon in there, but I know it's very difficult. It is a complex subject, and I think brain energy is another huge aspect of it. So yes, particularly I think the most research is in Alzheimer's. It's very clear that you get altered brain metabolism, and the brain cells end up not being able to access the energy that they need. And again, that relates back to insulin resistance, which is another huge topic in itself. But there's a lot of evidence of insulin resistance in being very common in many different mental disorders as well. So it's really trying to think of the whole picture. And I don't think it's all to do with diet. So obviously there are psychological aspects that come in, but I think also there can be other issues with mold and heavy metal toxicity and other avenues that mainstream psychiatry just doesn't tend to look into. So for example, in my day-to-day job and the training that we tend to have in psychiatry, you would check certain blood tests when somebody first presents to the service, to check they don't have a thyroid issue. You might do a lipid panel and see how that's looking, but generally we don't really, although we accept that inflammation is involved in mental disorder, we don't really look for the underlying root cause. So I've become increasingly frustrated in Western medicine that really is quite a simplistic approach where you make a diagnosis and then prescribe a medication. And I think there are missing links in there because we're not really thinking about what's driving this inflammation or what's the cause of this inflammation. And you see a lot of people with comorbid autoimmune issues with various other physical health diagnoses. And Western medicine, I don't want to be too negative about it because I think it's amazing in acute situations, but I think there's a lot that could be done better when it comes to chronic health conditions. You see a lot of people with various diagnoses like IBS, for example, or other, arthritis, other chronic inflammatory disorders, and all the specialties in Western medicine exist in silos. So we do talk to each other, but nobody really takes a step back and looks at the whole picture, and that frustrates me.
And then it requires really an individual doctor to become interested enough to learn, the more the complexities around it. And, I mean, there are a few doctors like that. I remember a few in the summit that have done that, but there's generally, it's not the standard approach, and we just do people such a disservice, by doing that. Yeah, because it has to be. Of course, it's all linked. I mean, how can you just work with one area and not consider, root cause? And the same with insulin resistance in the body. I mean, yes, I think that's agreed that that's a problem, but then what we do about that, we'll medicate.
We're not even good at diagnosing it because we're checking the wrong blood tests.
That's right. That's right. That's right.
There's so many people walking around with insulin resistance and they don't know it just because their blood glucose might be normal, but nobody's checking their fasting insulin. And it feels like, it's a huge hurdle to mount in terms of how medicine is practiced, certainly in the UK. So I know David Unwin's doing some really good work in terms of type 2 diabetes and reversing a lot of that within his practice, but he's very much an outlier. So the vast majority of general practitioners aren't working in that way. And I do know there's a lot of really good work being done in terms of trying to get that message out there that conditions like type 2 diabetes can be reversed using dietary strategies, certainly from David Unwin, and also the Public Health Collaborative that's been formed now with Asim Malhotra. So he's another person.
He's just a star, isn't he?
Yeah, big fan of. Absolutely.
Can I just mention more of those? Go.
Just something else that comes to mind is in the book I touch on food addiction, and I know I think Vitten Johnson might be at your event that you're organising. Again, I'm a huge fan of her work as well. That's something that's quite personal to me, because a reason that carnivore has been so good from my point of view is that it really clarified for me that I had some food addiction issues in the past that I was partially aware of, but maybe not fully aware of the full extent of it. So I've always known that I've had an issue with sugar, and I would say I'm a sugar addict. It's very interesting because I love having these discussions with people, and I know that some people have more difficulties giving up savory foods, so like crisps or chips or bread or pasta, and that was never really an issue for me. But going keto showed me that sugar was an issue for me. But I think carnivore really clarified it, because on keto, you have the option of making sweet, baking sweet items and making all the substitutes. the substitute foods, and those can be really great as a bridge to get somebody to reduce their carbohydrate intake down to a better level. But going carnivore gives you a whole new clarity when you don't have those foods. And actually it clarified things in a way for me that I wasn't really expecting. And I don't know how to word this properly, but I suppose retrospectively I realized that also when I was keto I had some issues, you know, for example with nut butter. That could be a common one for people. So that I maybe felt a little bit more out of control, or found it harder to regulate my intake of that, not to an extreme degree, but it was still a bit of an issue. And with carnivore, there's just been this complete clarity. So no preoccupation with food, no thinking about what the next meal should be, no counting macros or calories or any of that stuff that just would drive me insane personally. I know a lot of people like to keep a record of that, but I'm not one of those people.
No.
But yeah, just looking back, it really clarified to me some kind of more minor, kind of low-level food addiction type behaviors that were maybe still going on with keto when I did that. I hadn't really been fully aware of. So.
Fantastic. That's so interesting. I'm really glad you said that. I think I could resonate personally with that as well. I mean, the obsession I think I had when I went low carb was about nearly 10 years ago. And it was, you know, the space was totally different then. I mean, you had to make everything, but now, I mean, you can go to the supermarket and buy low carb, keto, everything now. But, you know, which I don't think I think is hard, and it is a trap for people. But yeah, I mean, it was just kind of, I just got to substitute everything. And I went down this rabbit hole of baking everything. And then I think my Hashimoto's diagnosis had a lot to do with all the almond flour, you know, the oxalates and all that, and lectins in all of that. I really, really do. But also, just that sweet craving that was very, very interesting when I went 6 months carnivore. Just how it still every night came up, because that was my habit, you know, dessert after I ate. And when I went keto, it would have been dark chocolate, or it would have been a keto treat or a
I think kind of in the evening in front of the television, just having to have some dark chocolate, even if it was. So I think when I said I was low carb, but not very low carb, it was 70% dark chocolate. And then I got 80, 90%. But even then, and I shudder when I think about, you know, all the oxalates and what I would have been taking in.
So would you say now that would you be 100% carnivore now, or?
So I probably can't say 100%. I think in terms of the food I eat, I am. I stopped coffee for quite a while. I did. So I'm actually somebody where I think it's quite a small proportion of people, but my triglycerides get elevated when I take coffee.
Oh, really?
And that was very interesting. Yeah. And I found that out because I'd been carnivore for a while, but still having coffee most days. And I did a lipid panel on myself, and it all looked great apart from my triglyceride to HDL level. It just wasn't as low as I expected it to be. And I thought, what on earth is going on here? And so you do your own research. And then I've forgotten his name, Dave. It might come back to me. There's a great website. The main person who looks into cholesterol and has done N of 1. Yes, that's it. Thank you. So he had a great section on his website where someone had done a coffee experiment and just charted their triglyceride levels, and with all sorts of different coffees, so straight coffee, decaf, French press, and they all to varying degrees elevated this person's triglycerides. And when I got rid of the coffee and did another test, my triglycerides were great again. So I also felt better off coffee. So I used to be we had an espresso machine at home. So I used to be a 2 or 3 espressos before I even left to go to work in the morning.
Oh, really? Oh, wow.
For years.
And nothing in it, just straight black?
Yeah, just black.
Oh,
wow. And I just stopped that cold turkey after I found out to do this found out about my lipids and wanted to do an experiment. I didn't have any withdrawal symptoms or any issues stopping really, and I actually felt like I had more energy day to day, which was very strange. And it also helped with my fasting, so I tend to have an eating window.
Yep.
7 or 8 hours. It varies a bit, but I know that a lot of people talk about coffee suppressing their appetite, but I actually just felt it was much easier to fast when I got rid of the coffee. I say I stopped for a long time, so I allow myself one at the weekend when I go out somewhere. But again, carnivore, it's been fascinating because I've heard a lot of people talk about the downsides of coffee, and Anthony Chaffee is one of the people that sticks in my mind, just in terms of his discussions about coffee and how he would experience a lot of aches and pains when he had coffee in his diet, and then delayed onset muscle soreness following workouts. And I kind of thought, oh, that's interesting. People have different experiences. I haven't really had anything like that myself until not that long ago, probably a month or two ago. We were at a sports day for my son, and there was a cart selling some coffee, and I thought, oh, okay, special day, I'll maybe just have one. And honestly, that evening I developed quite severe hand and wrist pain in one of my hands that I've never had before. I don't have any issues with arthritis or aches or pains otherwise. And that lasted the evening and into the following day. And the only thing that was different that day was that I'd had that coffee. Yeah. And I've had other times where I've maybe had a coffee somewhere unknown and then ended up with other type GI symptoms. And so that's only two occasions that's happened to me, but it's really highlighted to me the differences in coffees that you get and the mold issues that come with some of them. So goodness knows what that was, why that happened for me. I suspect it might have been something to do with mold contamination, but don't know for sure. But I think from my point of view, carnivore just has made everything very clear. So in terms of being 100% carnivore, I do use some herbs and spices now and again. So some people very strict wouldn't consider that to be carnivore, but otherwise I am meat and animal product based.
So just is it mainly steak or beef?
So mostly beef. Beef and lamb. I do eat bacon. Dairy's been a journey for me as well.
Me too.
I don't think I have a particular addiction issue with dairy, although I know for some people that cheese can be an issue. Heavy cream, double cream, possibly for me. But I've found out that pasteurized does cause some skin issues or flare-ups, and I tend to stick with sheep cheese that's raw now and again, so it's not a very regular feature in my diet, but it's something that I do enjoy from time to time that doesn't seem to cause issues in the same way that cows dairy does for me.
That's interesting, because one of the things that I get a lot, because I've got 5 kids, and I have clients that, not all my clients, I don't think carnivore is something that is necessarily right for everybody. I think it's an option in that under the umbrella of real food, and obviously there are the things, because I do Georgia Eats course as well, and I know that she talks about there's optimal things that the brain needs, which I want to get to too. But I'd love to ask you, how do you deal with it with your son? Because you said you have a 9-year-old son. So do you find it challenging in terms of meals, and do you obviously talk about with your son what you eat, and how does that go for you?
It is a challenge. So I have a lot of regrets there in terms of I wish I'd known a lot more about nutrition. So I knew some back after I had him, but there was a lot that I kind of let go, and he's quite a picky eater from the beginning. So he's got a thing about texture of foods. So he when he was very young just wanted crunchy things, and so like breadsticks and just all the foods that are far from ideal now in my opinion to be weaning young children onto. I think the thing that has been very noticeable from my point of view is just watching his journey. So I think sugar addiction starts at a very young age. You can see it you know, from toddler age, essentially. It took a bit of time to introduce him to meats and fish and foods like that. He's 9 now, and he's actually eating a lot more of that. And we have lots of discussions, so he knows what's healthy, what's not. I try not to be too idealistic in terms of what he has to eat, because I want him to be healthy, but I don't want him to feel excluded or very different to his peers. And you'll know what it's like. It's very difficult when there are kids' parties or other events that happen. And something just that really frustrates me is the school places a lot of emphasis on healthy eating, but their idea of what's healthy is not my idea of what's healthy.
Yep, same here.
Absolutely. So he was away on camp for 3 nights this year at school, first time away, and there was a video that the school did before they went on their trip, and it was talking about the dorms they'd be staying in and the different physical activities they'd be doing, and then it said about how they'd be eating more than they'd ever eaten before, and snacking. It's like so many snacks in a day. And the food, what would they have for breakfast? Fruit juice, cereals, pastries. And my husband looked at me when we were watching this, and we just looked at each other, and I had to laugh, because I don't know what else you do. And I thought, okay, let it go. He can go for 2 or 3 days, and I know he's going to make the most of it while he's away, because he doesn't like the fact I don't tend to have cereal in the house anymore. But,
it's funny. Oh, I can so resonate. It is very difficult in the environment we live in. It's no different here. My son's about to go off on camp. He's 9, and he has his 3-day camp coming up soon. And I'm doing the whole, work so hard to keep his gut healthy. And because I didn't know enough back then when he was born either, and I did rice cereal, and my little one, my youngest is 7. I knew enough for him that he's never had cereal, rice cereal, juice, never. He went breast to basically beef, like mince and steak and eggs and all that stuff. So he's, very different. But look, we do the best with what we know, and then we have to put it all into the context of the world we live in. I remember, this will make you feel better. So I remember Ben Bickman, when I interviewed him, who is just, next to my husband, I just, I adore him. And we had a conversation about kids, and he said the same thing. He's like, knowing what I know, he said, I still don't want my kids to miss out, and I want them to enjoy the world we live in. Like, we just had Halloween. He just had Halloween, and he goes, I let them go and collect it all, but I let them have a few and start to feel a bit sick, and then in the end they kind of go missing after a little while, but they still get to experience what kids experience. It's very difficult,
And then people say you don't want to, when you remove something, you just make it more desirable. So
well, it's true though, isn't it? That with us, like if we go on a diet and we're like, oh, I can't have that cake. Well, it's just cake, as opposed to, well, what is it that we want to do to nourish ourselves and the choices we make? The kids they don't have that capacity to think like that. So yeah, I know, very difficult. Well, I would love to get onto your book, and I'm very conscious of the time as well, but I could talk to you all day. I was hoping you could, I guess, just do a little summary on what is optimal. What would be an optimal diet for the brain? I mean, there's all these layers and different things, as we've just talked about, but there must be some things we know that really give our brain the chance at working optimally throughout the lifespan. Obviously, no one wants to sort of get to dementia and Alzheimer's, but wherever we are, we could start. And what would that be in your view?
So definitely different diets for different people. So there's not a one size fits all. I absolutely agree with that. I think people need to prioritize nutrient dense food. And it's very difficult, the messages that we've been given for many years now. So what tends to be in the food pyramid is not what would be considered nutrient dense, high quality food. So whole foods, unprocessed, I do think it's optimal for people to have meat and animal products in their diet, and fish can be a very important part of that in terms of the fatty acids you get from fish, the omega-3. So that's all of relevance in terms of brain health. I think for some people, food intolerances and food allergies can be an issue and can actually provoke mental health symptoms. So in my book, I cover the whole spectrum from a paleo diet through to keto, kind of lower carb keto, and then carnivore is the ultimate exclusion diet. And I think people, depending on their issues, are going to sit at varying points along that sliding scale in terms of where they need to be. I think it's also very important for people to consider what sort of person they are. So are they somebody who's better just going all in? Are they going to have an issue with excluding foods and feeling deprived? Are they better making a gradual transition into diet? And I think, again, it's no one size fits all. It's very different for different people.
Mm.
So yeah, so I'm sorry.
No, sorry. No, you go.
Oh no, it's okay. Go on.
I was just going to say, so one of the questions people sort of say is, how do you work out where to start? And I personally think you have to try things. And I think it's very difficult to kind of say, well, you know, this is your diet. You know, you really have to experience it and try different things. But what would be your advice to someone, you know, who sort of asked you, well, where do I start? Is paleo or is it carnivore or?
So I think if somebody has a major mental health disorder, I would go somewhere in the middle and I'd say keto. That's what you should aim for. And to give it a few months at that. So I talk about the kind of usual issues that people might run into in the first few weeks of keto, and the difficulties with what people call keto flu, although I tend to think it's carbohydrate withdrawal.
Yeah. Yep, I agree.
But I think keto could be a really nice place to start for people, and then you need to troubleshoot as you go along. So for many people, keto can be very beneficial. For others, there might be food intolerances or allergies within that they need to fine tune and start excluding. If somebody wants absolute clarity and they think that they have food intolerances or food allergies, then carnivore is just the simplest and it's the ultimate exclusion diet. And I am a fan of the food intolerance testing that you can have done in terms of blood testing, because that's highlighted a lot of issues for myself and my family. I know they're not accurate, they're not 100% accurate, and so I would never say to somebody to absolutely rely on those tests, but that can be another way of just trying to work out for an individual what potential foods might be causing an issue for them to be able to then exclude them and then try challenging themselves by adding one back in at a time. But yeah, definitely carnivore would be the ultimate elimination diet. But then not everybody, as you say, needs to go that far with it.
Is it I mean, obviously when we talk about ketogenic diets, it's that metabolic production of ketones, right? So can you talk a little bit about ketones as being the fuel for the brain? I mean, is it the optimal fuel for the brain, and is that necessary to get to ketogenic, you know, a ketogenic state, to be producing ketones for the brain at various times in our life?
Yeah, so I mean, ketones are a very clean fuel for the brain. So a lot of people would regard them as optimal. There are certain parts of your brain that still need a certain amount of glucose to run on. But people don't really need to worry about not having that if they're not eating sugar, because your body produces the glucose that it needs via the liver. I just think in terms of ketones, we know that they're anti-inflammatory, they reduce inflammation in the brain. There's evidence that people with cognitive dysfunction, so it could be mild cognitive impairment or even frank dementia, Alzheimer's, that they do improve on cognitive scores when they're converted onto a ketogenic diet and have a measurable level of ketones in their blood. We know that it improves brain energy because your body produces more mitochondria in your cells, which are the energy powerhouses of the cell. So there are many different reasons why ketones are optimal for mental health. And that's why I would say it's worth anyone who's really struggled with their mental health at least trying a ketogenic diet to see if that brings them benefit and symptomatic improvement.
Do you think the benefit's different if it's exogenous versus endogenous? So, you know, is there what's your view on that? Everyone has different opinions.
Okay, so I think endogenous is just naturally and intuitively going to be more beneficial. Having said that, I do know some people who've really struggled with elderly parents just not being willing to change their diet, or that some people really struggle to stick with a strict diet. And I think it is worth trying exogenous ketones or MCT oil, for example, in those situations, just to see, because I think there can be some potential benefit from them. But I don't think having a standard kind of Western diet and then adding in exogenous ketones or MCT oil to that is likely to bring about a huge, like, significant improvement. I think it just always goes back to the basics, that the body knows what it needs, and natural healthcare would be the ideal. And so if your body is producing ketones naturally, and not having to compete with all the inflammatory glucose and the blood sugar spikes that would continue to happen if you're still following a standard Western diet, you know, I just think the body knows what it's doing. And that would be the ideal.
Yeah, absolutely. Well, your book is called Metabolic Madness: Understanding Why Metabolic Health is Key to Mental Health, and I would recommend everyone watching this to buy on Kindle. Is it available in paperback or hardcover now, or maybe by the time the summit?
It's available on Kindle and paperback. So yeah, both versions. I just want to say to people not to expect a hugely lengthy book. So I set out to try and keep things simple and just get a simple message across, and make it accessible for as many people as possible. So I hope I've done that in the book.
I think you have. I've read pretty much all of it. I'm going to refer back to it. There's just so much great stuff in there, and you know, I think there's such a need for what you've done. So thank you so much for doing that. And you know, I hope it just continues to sell and gives people options and shows them that there is another way. And that's really what it's about, isn't it? There are alternatives, and you know, if something's not working for you, try something different and see where it gets you, and don't be afraid to try something different.
Absolutely. And I'm a huge fan of people just being their own health advocates. So not to feel that they have to rely on a particular health system or a way of doing things. So I've learned a lot of lessons in my life in terms of my own health, and I have dogs, so their health. So yeah, I can't emphasize enough people just doing their own research, and just not automatically trusting the so-called experts out there. So there are often competing interests for why certain guidelines have been developed, and financial interest in some people who are behind putting certain health messages out in the mainstream. So yeah,
I think
doing
that's
your own
great.
research.
Yeah, fantastic advice to end. And thank you so much for your time today. It's such a pleasure to chat to you and meet you. And thank you for being part of the summit.
Oh, thank you very much for having me.
Thanks, Rachel.